case, a 55-year-old man who is hypertensive since 8 years presents to the emergency department with history of sudden weakness of the right side of the body, slurred speech, which is associated with loss of balance and inability to walk. On examination, pulse rate was 98 beats per minute, BP was very high, 220 by 190 mm of mercury. There was hypotonia and absence of deep tendon reflexes on the right side of the body. Sensory deficit could not be assessed, and a CT and MR angiogram was done. So what is the most probable diagnosis in this case? Name two differential diagnosis. What are the etiological factors responsible, and add a note on the management. Write a short note on cerebral blood flow and add a note on circle of Willis. This is a case of stroke where due to high blood pressure there may be rupture of some cerebral blood vessels leading to neurological signs and symptoms of stroke. But these signs and symptoms can also occur in case of epilepsy and tumor conditions, which can also lead to such neurological signs and symptoms due to damage to the neurons. So what could be the etiology of stroke? It may be obesity, smoking, cardiac diseases, then myocardial infarction which interferes with the blood supply, diabetes mellitus, alcohol, bacterial endocarditis, and protein C and protein S deficiency, which are the anticoagulants. For treatment, we would like to use fibrinolytics to dissolve the clot which is formed, then aspirin. And because of the hemorrhage which has occurred, there will be increase in cerebral pressure. So, mannitol is used for relieving the cerebral edema. Then, what are the characteristics of cerebral blood flow? Well, first of all, these are end arteries and they are non-fenestrated. That means there is no leakage of substances from the blood vessels into the surroundings, and that is also because of the presence of tight junctions which prevent passage of harmful substances. So, these two, that is the non-fenestrated arteries, that is there is no space between the endothelial cells, and the presence of tight junctions. This is important for formation of blood-brain barrier. Then, whenever there is increased blood flow, there is increased venous outflow as well, because this is important to maintain the cerebral pressure, since the skull forms a closed cavity which is enclosing the brain. So, the pressures in this closed cavity should be constant, otherwise it will lead to cerebral edema. Then, what is circle of Willis? Circle of Willis is anastomosis of a number of arteries which is present at the base of the brain, and these arteries include the basilar artery, two internal carotid arteries, anterior cerebral, middle cerebral and posterior cerebral arteries.